Okay, so today we are going to deal with, we'll start with the brainstem. There are total of 5 sessions, placed in for brainstem. So if you are looking at 72 slides, don't get panicked. We are going to go very slowly. The only task which we are going to do today is probably talk about some of the external features of the brainstem. And then once we finish up the external features, then we would look at the gray arrangement of the gray matter and the white matter, the nuclei, how they are located, and what are the functions of these nuclei, first in a longitudinal orientation. And then we will go to the cross sections and we will see, uh, the cross sections of medulla, pons, and midbrain. So two sections of medulla, lower and upper. Similarly, two sections of pons, lower and upper, and two sections of midbrain, lower and upper, in terms of the arrangement of the nuclei, the arrangement of the white matter, and then we will move on to cranial nerves, the cranial nerve nuclei, components of those cranial nerve nuclei, those type of things. And then we are not going to do the peripheral piece of the cranial nerves, because the peripheral distribution, the branches of the cranial nerve, is a part which you are going to do with the head and neck. So what we are talking about is the location of the cranial nerve nuclei and the components of the cranial nerve nuclei and their functions. But we are not talking about how the cranial nerves are going to supply different regions in the head and neck region. We'll just talk about, oh, this supplies this, and this is the nucleus. But the branches, the course of the cranial nerves, this is what you are going to do in the uh, uh, head and neck block. The last piece is going to be about the lesions. So we would talk about if there is an injury at the medulla or pons or midbrain, if the medial medulla is affected or the lateral medulla is affected, lower part of the medulla is affected or the upper part is affected. Similarly, for pons and midbrain, we are going to talk about some different types of lesions associated with the brainstem and how the patient is going to present. But first, we are going to look at the anatomical location and functions of these nuclei and tracts before we go into details of lesions. So this is a long process. We are going to take about 5 sessions to reach there. So today's task mainly is to look at the external features. What you need to know about brainstem is that brainstem has several functions. First, it is a conduit for the tracts. So the ascending and descending tracts, which you saw in the spinal cord, those ascending tracts have to pass through the brainstem to reach thalamus and beyond. And similarly, the descending tracts, the corticospinal and the rubrospinals and the vestibulospinals, they all pass through the brainstem to reach the spinal cord. So, and there are tracks which are relaying to the cranial nuclei, so corticonuclear tracts. Similarly, from cortex to cerebellum and cerebellum back to the cortex, there are connections. So it is acting as a conduit through which different tracks are either descending down to the spinal cord or they are ascending up to the higher centers. The second important thing about brainstem, that it has the cranial nerve nuclei for the cranial nerve 3 to 12. There are 12 cranial nerves, and the first two would not have their nuclei within the brainstem, but from 3 to 12, all cranial nerves would have their nuclei located within the brainstem. So any injury to brainstem can affect the nuclei of cranial nerves 3 to 12, and wherever they are going to supply, those could be affected based on the location of those nuclei. Okay, so the second important thing is, first, it is a conduit for the tracks which are either going up or going down, passing to the spinal cord, going to the cortex. You need brainstem. So any injury to brainstem can affect those tracks. The second important thing is that the gray matter in the brainstem has the location of the cranial nerve nuclei from cranial nerve 3 to 12. The first and the second cranial nerve, olfactory and optic, do not have cranial nerve nuclei within the brainstem. Okay. The third thing is that brainstem is also a center for several reflexes, respiratory, cardiovascular reflexes, because respiratory center and cardiovascular center are located within the brainstem, and it is connected to hypothalamus, forming the sympathetic and sympathetic system. So passages of the sympathetic pathway are also passing through the brainstem. So cardiovascular and respiratory reflex centers are also present within the brainstem. It is also very important for maintaining consciousness because the reticular activating system is also present within the brainstem. So these are some of the important things why brainstem is that important. It is, it is a conduit. So all the ascending, descending pathways are passing through it. Any interruption here is going to affect those ascending and descending pathways. So both motor and sensory losses in the rest of the body as well as in the head and neck region can be affected. Cranial nerve nuclei from 3 to 11, 3 to 12 are all present within the brainstem. There are important reflexes like cardiovascular and respiratory reflexes. They are centers of cardiovascular control and respiratory control are present within the brainstem. And it is also a place where the consciousness is maintained. So the reticular activating system is there. So that's why it is very, very important for us to understand brainstem, because it can be an area where the stroke can happen. The blood supply could be occluded and could be a part of the brainstem getting into stroke. It could be an area where there is a degenerative disease happening. It could be an area where there is a tumor which is compressing the brainstem can happen. So all those type of pathologies can affect the brainstem, and that's why, and why what structures are passing. So that's why it is so important to know the anatomy, and then see the location of different gray matter structures and white matter structures to make out that uh, you can locate the site of the lesion based on the information, clinical information you're getting, because then if you know which structures are located where and damage of which one will result in what type of clinical features. Okay. So the objective here is to describe the external features of the brainstem, describe the sensory motor tracts and the nuclei of different sections of the brainstem, both longitudinally and cross-sectionally. We are going to look at it. We would relate the location of cranial nerve nuclei with clinical presentation in case of lesions affecting different pathways and the gray matter structures within the brainstem. So these are the three major objectives of the brainstem sessions. There are three parts of the brainstem: the midbrain, pons, and medulla. So you would see that the lower part is the medulla, then the middle piece of the brainstem is the pons, and then you have the midbrain. And midbrain is the one which is connecting the brain to the brainstem to the higher centers. And below the medulla, you have the spinal cord. So medulla is connecting the brain with the spinal cord. So let's look at the external features. So what we are going to do is that we are going to see the brainstem from the front, and then we are going to see the brainstem from the side, and then we are going to see the brainstem from the back. So if you see the ventral aspect of the brainstem, which is also called the basal aspect because it is lying on the top of the base of the skull. So the cranial cavity and this ventral aspect which you are seeing here, it is lying over the base of the skull. So it is sometimes also called basilar part because it is lying on the base of the skull. So what you are seeing, this lower part is medulla. Okay, this middle part is pons, and this upper part is midbrain. So first look at the medulla. If you look at the medulla from the front, what you are looking at, you see there is a median fissure. Can you make out this fissure? There's a median fissure like the median fissure which you saw in the spinal cord. So this median fissure is going to continue down towards the spinal cord and form the anterior median fissure of the spinal cord. So this is the median fissure which you see on the front of the medulla. Then you see these two elevations. Can you make out these elevations? These two elevations which you see just on the side of the median fissure, because this is the front part, is called the pyramids. And it is formed by the pyramidal tract. And if you see that lower part of the medulla, the fibers are crossing. So they are forming the motor decussation. So, and they are going to form the lateral corticospinal tracts as they are going to cross. So on the front of the medulla, you see a median fissure. On the side of the median fissure, you are seeing two triangular elevations, and these two triangular elevations are called pyramids. They are formed by the corticospinal tract. Just next to the pyramid, you can see another elevation. Can you make out these elevations? These elevations are called olives because they look like olives. So they are called olives. They are formed by a nucleus or a gray matter within the medulla, which is called inferior olivary nucleus. So inferior olivary nucleus is the cause of the formation of the elevations just next to the pyramids, which is called the olives. Now you see a groove between the pyramid and the olives, and you see a nerve coming out. Can you make out this nerve? This is the pyramid, this is the olive, and this nerve is coming out, which is the hypoglossal nerve. This is the 12th cranial nerve. The function of this 12th cranial nerve is to supply motor supply to the tongue. So all muscles of the tongue are supplied by this nerve, which is the 12th cranial nerve, and it is called hypoglossal nerve. It comes out between the olive and the pyramid. Next, you are seeing another elevation, which is just behind the olive. And this elevation, which is behind the olive, is connecting the medulla with the cerebellum, and it is called inferior cerebellar peduncle. So the elevation just behind the olive is the inferior cerebellar peduncle, which is connecting the medulla with the cerebellum. Now here you see three rootlets in the groove between the olive and the inferior cerebellar peduncle. The first one is the 9th cranial nerve, which is called glossopharyngeal. Next is the vagus, which is the 10th cranial nerve. And the third one is the accessory nerve. Now the 9th cranial nerve is glossopharyngeal, so it supplies the sensory supply to the tongue, posterior 1/3 of the tongue, and it is also going to supply sensory supply to the pharynx. It only supplies one muscle of the pharynx, which is the stylopharyngeus muscle. So 9th cranial nerve is called glossopharyngeal. So glosso means tongue, pharyngeal means pharynx. So posterior 1/3 of the tongue sensory supply, and the pharyngeal sensory supply is coming from glossopharyngeal nerve. It supplies only one muscle or one motor supply, which is one muscle, which is stylopharyngeus muscle of the pharynx. The rest of the pharynx is not, the motor supply is not coming from him. Then you have the vagus. Vagus is the 10th cranial nerve. It is going everywhere. That's why it is called vagabond and vagus. So it is supplying the muscles of the pharynx. It supplies all the muscles of the pharynx except the one which is the stylopharyngeus. It supplies the muscles of the larynx. It supplies the smooth muscles of the respiratory tract. It supplies the smooth muscles of all the intestine up to the right two-third of the transverse colon. So this is the area of, it also supplies the heart. So you need to know that the vagus nerve is supplying several places, but supply of the vagus nerve to the muscles of the pharynx and the muscles of the larynx is through the cervical part of the accessory nerve, which is the 11th cranial nerve. So 11th cranial nerve, the part which you are seeing here is the spinal part of the accessory, which supplies trapezius and sternocleidomastoid. Cervical part of the accessory nerve, the 11th cranial nerve, merges with the vagus nerve and supplies the muscles of pharynx and larynx. So this is what you are going to see at the front portion of the medulla. So you see a median fissure, you see pyramids, you see the olives, you see the 12th cranial nerve exiting out between the olives and the pyramid. 12th cranial nerve supply, the motor supply to the muscles of the tongue. The area between the olive and the inferior cerebellar peduncle, you see 9th, 10th, and 11th cranial nerve. 9th is glossopharyngeal. It supplies the posterior one-third of the tongue and the pharynx, the sensory supply. The vagus supplies the muscles of the pharynx and the larynx, and it is also going to supply the heart and the smooth muscles of the intestine up to the right two-third of the transverse colon. The supply to the muscles of pharynx and larynx is through the cranial part of the accessory, which merges with the vagus. The spinal part of the accessory nerve, which is the 11th cranial nerve, supplies two muscles. One is sternocleidomastoid, the other is trapezius. The next one, over the top of the medulla, we are just on the front piece. We are not seeing the lateral side. We are just looking at the brainstem from the front. So from the front, you see just above the medulla is this part of the pons, which is the basilar part of the pons, which sits on the base of the skull. Pons is called pons because pons in the Greek language means bridge. So it's a bridge between the two cerebellar hemispheres. So the fibers which you see on the pons, on the basilar part of pons, are usually transverse fibers, which are connecting the fibers which are coming from the cortex to the pons and then going into the cerebellum. Okay, so you would see on the basilar part of the pons transverse fibers like this, because they are coming from the cortex, going to the pons, and then going into the cerebellum. So pons is acting as a bridge between the two cerebellar hemisphere, and it is connecting the cortex with the cerebellum. So the fibers are coming from the cortex, going to the pons, and then going to the two cerebellar hemispheres. So you would see transverse fibers here. In the center, you would see a groove, which is called the basilar groove. And this basilar groove lodges an artery. There are two vertebral arteries which are coming over the top of the medulla. They are going to merge here, form a single artery, which is called the basilar artery. So there are two vertebral arteries coming from the cervical vertebra. They go over the surface of the medulla, and at the junction of pons with the medulla, the two vertebral arteries are right and left are going to merge and will form a central artery here, which is going to be called as basilar artery. So in the basilar groove, you are going to see an artery, which is called the basilar artery. It is formed by the merging of right and left vertebral artery. Now, if you see at the junction of pons with the medulla, there are a number of nerve rootlets which are coming out. So the medial one is called the sixth cranial nerve, which is the abducent. It supplies only one muscle in the eye, which moves the eye laterally. So it is the abducent nerve which supplies the lateral rectus muscle, which moves the eye laterally. So this one, the most medial nerve rootlet at the junction of medulla with the pons, is the abducent nerve, which supplies one muscle in the eye, which is the lateral rectus muscle. Then you see the seventh cranial nerve, which is the facial nerve. Now the name says facial, so it supplies the muscles of facial expression like smiling, other things. So smiling, frowning, whatever the facial expression. So facial nerve is a nerve which supplies the muscles of facial expression. It also has a parasympathetic component, and it supplies the parasympathetic supply to the salivary glands like the submandibular and sublingual gland. The parotid gland, the big gland here, is supplied parasympathetic supply by glossopharyngeal, but the parasympathetic supply to the other sub salivary glands like the submandibular and sublingual, as well as lacrimatory gland, which produces tears, are supplied by the facial nerve. So mainly facial nerve is a motor nerve which supplies muscles of facial expression. It also has parasympathetic component. It supplies the submandibular, sublingual, and the lacrimatory gland. Then you see the eighth cranial nerve, which is at the lateral most part of the junction of the pons and medulla, and this is called vestibulocochlear nerve. So it has vestibular and cochlear components. Vestibular is for balance, and cochlear is for hearing. So this is the eighth cranial nerve. This is mainly responsible for balance and hearing. In the upper part of the pons, you see the nerve which is coming out, and this is the trigeminal nerve. It has a bigger, larger sensory rootlet and a smaller motor rootlet. The major, bigger sensory rootlet supplies the skin over the face. So sensory supply from the head and neck region, especially the face and the scalp, is coming from trigeminal nerve. So trigeminal is responsible for getting pain, temperature, touch, two-touch discrimination, vibration, whatever it is. All sensory supply from the face is going to go to the trigeminal. All motor supply from the face is facial. So fifth cranial nerve or the trigeminal nerve is for the sensory supply from the face, and it has a small motor component which supplies muscles of mastication, which is important in chewing. You are basically moving your jaw. This is not your muscles of facial expression. These are the muscles which move your jaw, and they are called muscles of mastication. There are four muscles: temporalis, lateral pterygoid, medial pterygoid, and the lateral medial pterygoid and temporalis and masseter. Those four muscles are important in terms of muscles of mastication. If you don't remember the names at the moment, doesn't matter. You wouldn't. We would talk about the muscles of mastication later on in the head and neck also, and you see the origin, insertion, what is their movement, whatever. But the important thing is trigeminal has a major sensory rootlet, which is mainly taking the sensations from the face and the scalp, and it has a small motor rootlet which supplies the muscles of mastication. Next, we are going towards the midbrain. You see the midbrain, you see these two peduncles. Can you make out these peduncles? These peduncles are called cerebral peduncles. They are called cerebral peduncles. The major component within the cerebral peduncles are corticopontine fibers and corticospinal and corticobulbar fibers. So corticospinal, corticobulbar, and corticopontine fibers are the ones which are going to form these peduncles, which we call cerebral peduncles. And in between the two peduncles, there is a fossa. So this fossa is called interpeduncular fossa. So there are two peduncles, cerebral peduncles. Between them, there is a fossa which is called interpeduncular fossa. From the interpeduncular fossa, you see this nerve which is coming out, which is the oculomotor nerve. Now, oculomotor nerve supplies all the muscles of the six extraocular muscles of the eye, which move the eye, except two muscles. One is the lateral rectus, which is supplied by the sixth nerve. And then there is another muscle which is called superior oblique, which is supplied by the fourth cranial nerve, which you don't see here, which is the trochlear. You are seeing third, fifth, sixth, seventh, eighth, 9, 10, 11, and 12. You are seeing all these nerves except the one which is the fourth cranial nerve, which is the trochlea, which comes out from the back of the brainstem. That's why all of the others are coming out from the front of the brainstem, except the one which is coming out from the back, which is the fourth cranial nerve. It is going to supply one muscle in the eye, which is the superior oblique. So oculomotor nerve supplies all the muscles of the eye which move the eye except two muscles. One is lateral rectus, which moves the eye outward, and the other is the superior oblique, which is supplied by the trochlear nerve. You can also see within the interpeduncular fossa, there is the stem of the pituitary gland, which is the infundibulum. You can see here the mammillary bodies. You can also see that in front of the interpeduncular fossa, optic chiasma is formed, and then the optic tracts are curling around the cerebral peduncles to go back to the lateral geniculate body. So this is what you are seeing on the front of the brainstem. Okay, everybody clear? Any problems? Yes. This is optic chiasma, and this is the optic tracts which are curling around the cerebral peduncles to go back. So they are not connected with cerebral peduncles, but the optic tracts are curling around on the side of the cerebral peduncles to go back to the lateral geniculate body. In the interpeduncular fossa, there is the combination of the different arteries, which is going to give rise to the circle of Willis. So there is internal carotid and its branches, and these basilar artery and its branches are going to anastomose in this interpeduncular fossa to form a circle, which is called circle of Willis. When we will talk about the blood supply of the brain, circle of Willis is important. So the brain is supplied by two systems. One by the vertebral artery, which is coming from the subclavian. The other is the internal carotid artery. So the branches of the internal carotid and the branches of the basilar system are going to form an anastomosis in the interpeduncular fossa, which is called circle of Willis. Okay. Now we are going to look at the brainstem from the side. So we have looked at it from the front. Now we are going to look at it from the side. So this is what you are seeing from the side. This is the pyramids in the medulla, and the nerve which is coming out between the pyramids and the olive is the hypoglossal nerve, which is the 12th cranial nerve supplying the muscles of the tongue. Then behind the olives, you have the 9th, 10th, and the 11th cranial nerves. These nerves, 9th is the glossopharyngeal, which supplies the sensory supply to the posterior 1/3 of the tongue, and it is also responsible for supplying the sensory supply to the pharynx, and it supplies one muscle in the pharynx, which is stylopharyngeus. Parasympathetically, it is going to supply the parotid gland. The vagus nerve is going to supply muscles of the pharynx and larynx, and then the smooth muscles of the GI tract up to the right 2/3 of the transverse colon is also going to supply parasympathetic supply to the heart. The 11th cranial nerve, which is the S3, this is the spinal part of the S3, which supplies the trapezius and sternocleidomastoid. The cranial part of the S3 is going to join the vagus to supply the muscles of pharynx and larynx. Then you are seeing, what you are seeing here is, this is the abducent nerve, this is the 7th cranial nerve, and this is the 8th cranial nerve at the junction of the pons and the medulla. Posteriorly, if you see those two tubercles at the back of the lower part of the medulla. These two tubercles are the nucleus gracilis and the nucleus cuneatus. And these are the tracts which are coming, the fasciculus gracilis entering into the nucleus gracilis, and fasciculus cuneatus is entering into the nucleus cuneatus. Laterally here, you are seeing the the on the upper part of the pons, you are seeing the motor and the sensory rootlet of the trigeminal. And then if you see the lateral part of the midbrain, this is the cerebral peduncle. You can see these two collar-like elevations, two upper collar-like elevations and two lower collar-like elevations. These elevations are superior colliculus and inferior colliculus. Superior colliculus is responsible for the visual reflexes. Inferior colliculus is responsible for auditory reflexes. Plus, from the back, you can see a nerve coming out, and this nerve is the trochlear nerve or the fourth cranial nerve. Now we are looking at the brainstem from the back. So you should remember that in the upper part of the medulla and the whole of the pons, the posterior part is covered by the cerebellum. So we have removed the cerebellum, and now you are seeing the back of the brainstem. So if you see the lower part of the medulla, it is going to be formed by, you can see the tubercle, gracile tubercle and the cunate tubercle, which are formed because of the nucleus gracilis and nucleus cunatus. And laterally, there is inferior cerebellar peduncle, which is joining the medulla with the cerebellum. But as you go to the upper part of the posterior surface of the medulla, you find this is the floor of the fourth ventricle. So this diamond shaped space, which you are seeing, this diamond shaped space, which is bounded above by the superior cerebellar peduncle. This is the superior cerebellar peduncle. This is the middle cerebellar peduncle. And this is the inferior cerebellar peduncle, which is bounding this diamond shaped space. This is the floor of the fourth ventricle. Now, in the floor of the fourth ventricle, you would have the median sulcus in the center. So what you are seeing, this is the median sulcus. And this elevation on the side of the median sulcus is called median eminence. It is called median eminence. So there is a median sulcus in the center. This side of the median sulcus, you have two eminences, which are called median eminences. The lower part of the median eminence form a collar-shaped, structure, which is called the facial colliculus. So the rounded portion of the lower part of the median eminence forms the facial colliculus. This happens because the facial nerve curls around the abducent nucleus. So it forms a collar-type elevation at the floor of the fourth ventricle, and that is called the facial colliculus. The lateral limit of the median eminence is called sulcus limitans. So this lateral limit of the median eminence is called sulcus limitans. This area which you see laterally is the vestibulocochlear area. So this in the posterior part of the lower part of the medulla or the upper part of the medulla, you would see vestibulocochlear area which is lying laterally. If you go medially, you would see two triangles. One is the hypoglossal triangle, the other is the vagal triangle. Hypoglossal triangle lodges hypoglossal nucleus, while the vagal triangle will lodge the vagal nucleus, the dorsal vagal nucleus, which is the parasympathetic nucleus of the vagus. So these are the things which you are going to see on the posterior surface of the upper part of the pons and the posterior surface of the pons and the upper part of the posterior surface of medulla. If you go at the midbrain level, you see these collar type elevations. Can you make out this? This is superior colliculus. These two. These are the superior colliculus, which are going to give rise to which are the centers for visual reflexes. And this is the inferior colliculus, which is the center for auditory reflexes. And below the inferior colliculus, you would see a nerve coming out from the posterior aspect of the midbrain, which is called the trochlear nerve, the fourth cranial nerve, which supplies one muscle, which is the superior oblique muscle. Can you make out these things at the posterior surface of the brainstem? Okay. So this is, generally giving you the functions of the cranial nerves. Olfactory and optic are not related to the brainstem. So olfactory is the first cranial nerve related with smell. Optic is the second cranial nerve, which is related with vision. Yes. So here, just below the inferior colliculus. So optic is for sight. Oculomotor, as I said, supplies all the muscles of the which move the eye, except two muscles. One is the lateral rectus, the other is the superior oblique. Fourth cranial nerve supplies the superior oblique muscle. It's purely motor. Trigeminal is mainly sensory supply, all the face except it has a small motor component which supplies the muscles of mastication. So facial sensation and the mastication, and also anterior two-third sensory sensations are going to go to the trigeminal. Abducent is supplying only one muscle in the eye, which is the lateral rectus. Facial nerve is for the muscles of facial expression. It is for salivation because it supplies submandibular and sublingual gland, and lacrimation, it is supplying the lacrimal gland. Vestibulocochlear is the eighth cranial nerve, which is for hearing and balance. Glossopharyngeal nerve supplies the sensory supply to the pharynx and the posterior one third of the tongue, and it also gets taste sensation for posterior one third of the tongue. It is responsible for supplying parasympathetic supply to the parotid gland. Vagus, it is for the taste for the supraglottic region, swallowing, soft palate, talking, coughing, reflex, parasympathetic to thoracoabdominal viscerals, and monitoring aortic arch and chemobaroreceptors. Necessary for head turning because it supplies the sternocleidomastoid, and shoulder shrugging because it supplies the trapezius. Hypoglossal for the movement of the tongue. So these are the cranial nerves and roughly their functions. Again, this diagram is going to show you the location of different nerves. That was a more of a hand-driven diagram. Here you can see the pyramids here. This is the olive. This is hypoglossal, 9th, 10th, 11th cranial nerve. At the junction of pons and medulla, you can see the 6th, 7th, and the 8th cranial nerve. This is the pons. This is the basilar groove. This is the trigeminal nerve, which you can see. You have the sensory rootlet and the motor rootlet, sensory supplying most of the facial uh, part of the skin, and the motor supplying the muscles of mastication. From the posterior aspect of the brainstem, you can see the trochlear nerve curling from the back to front, which supplies the superior oblique. These are the cerebral peduncles. And from the interpeduncular fossa, you can see the oculomotor nerve coming out, which is the third cranial nerve, supplies all the muscles of the eye except superior oblique and the lateral rectus. You can see the mammillary body and the stalk or the infundibulum of the pituitary. This is the optic chiasma, and then you can see the optic tracts curling around the cerebral peduncle to go back to the lateral geniculate body. This is the back of the brainstem. You see the gracile tubercle and the cunate tubercle. This is the floor of the fourth ventricle, and you can see the median, sulcus, and then you have the median eminence. The lower part of the median eminence is basically the facial colliculus. This groove is the sulcus limitans. This is the vestibular area. Then you see the vagal triangle and the hypoglossal triangle, and this is the area postrema. You see the back of the brainstem of the midbrain, you would find the superior colliculus, the inferior colliculus, and then you can see the trochlear nerve existing out just behind, just below the inferior colliculus level. So these are the external features of the brainstem. If you look at the base of the skull, you would find out that why these cranial nerves were placed 1 to 12. Because if you see, this is the front part of the cranial cavity, and this is the cribriform plate from where the olfactory fibers are going to the brain. So the first cranial nerve, which is responsible for the sense of smell is going through the cribriform plate going up. Then you see this optic canal giving rise to the optic nerve, or the second cranial nerve, which is responsible for vision. Then from the superior orbital fissure, you can see the third, fourth, and the sixth cranial nerves going into it. So you would find out there, and part of the trigeminal, which is the fifth cranial nerve, which are passing through the superior orbital fissure. Then you have part of the trigeminal passing through foramen rotundum, and part of the trigeminal passing through the foramen ovale. So third, fourth, fifth, and sixth are gone. Then you see the internal acoustic meatus through which the seventh and the eighth cranial nerve are passing. So the facial and vestibular cochlear are passing through the internal acoustic meatus. Like you have external acoustic meatus here, there is inside the skull internal acoustic meatus through which the seventh and the eighth cranial nerve are passing. Then you have the jugular foramen from where the ninth, 10th, and 11th are passing. And then you have the hypoglossal canal through which the 12th cranial nerve is passing. So if you see the location of these nerves, this is front backwards. That's why they are named 1, 2, 3, 4, 5, 6, 7, 8, 9, 12. The first one is at the front, which is the olfactory, and the 12th one is at the back, which is the hypoglossal. Okay, so I'll stop here, and then we will start to talk further tomorrow, and then we look at the cross sections in the longitudinal order, and then in the cross sectional order. Yes. No, you see on in the basis of the base of the skull, not on the surface of the brain. No, how they are exiting out from the skull. You see there, 9th and 11th are exiting out in front of the 12th, because 12th is the front part of the medulla is lying like this on the skull. So 12th is below, 11th is 9th, 10th, 11th is above. You understand what it is?
Doctor, can I ask you a question? Can you
Sure,
or for the spinal cord?
Yeah.
Why do we have spastic paralysis in central?
Yeah. So